That's what they're doing with with collagen. And but you can create some really nice lips with it and give a little bit, especially for the women that are getting the little lines and they just don't like it. You can correct that slightly. So collagen is the most widely used, and these are some of my patients. You can see before and after correction of the nasolabial fold. You're going to be listening about the hyalurons, which are Perlane and Ristylane, and these are at the FDA. So they should be, we should be getting approval of these two substances. And again, this is like collagen 1 and 2. One of them is lighter than the other. So the thicker one is used to correct deeper defects. And again, it depends how deep the areas are and how much correction you'll need and how much substance you'll need. And you can see this is another patient before correction, mid-correction, and after we had full correction. New fill is coming in the market. I'm going to be doing some studies. This is another substance. It's available in 26 countries. It's not FDA approved. Bioform. It's really interesting. This is another substance that's going to be approved soon, and it's already approved by the FDA for other uses. And very, very safe, and it's a material that's almost like bone, and it lasts about 3-4 years, because the disadvantage of collagen that it's like Botox, that it's only going to last 4 to 6 months. Again, this is a patient with Bioform, and look at the nice correction before and after. So, you know, what is the dynamics of managing cutaneous aging? The first thing, we really need to focus on those factors that I mentioned, the extrinsic factors, because the intrinsic factors, there's nothing we can do with what our genes are going to do with our aging process. But there are some factors that we can correct, such as pollution, smoking, external factors such as ultraviolet radiation. So prevention is very, very important, and protection, particularly sun. And then these are all the procedures that we have that are very, very safe, not very aggressive, non-surgical, that we have available to treat. Patient education, which is very important in terms of sunscreen. I think everyone should be on a comprehensive skincare program with products that actually do something and that will reverse some of that damage and some of the aging and the pigmentation and just perk up your skin a bit. After that, we've talked about the chemical peels. Microdermabrasion is a little bit more aggressive than chemical peels. You've seen tons, because there was only one machine in the market a couple years ago. Now there's like 100 of them, and there's different grades, so you have to be careful, because the one you have at the beauty salon, of course, is not the same one, the grade that we have at physicians, which are physician grade. So there's a big difference in the effects of these machines, but they do improve the tone, the textures, the non-ablative lasers, which I mentioned, and of course Botox and filler agents that you've heard about. And I think the beauty of all these is that we combine all these procedures and we can get really, really great results. For example, in these patients, we combine the use of Botox with filler agents, and then we can also combine fillers with Botox in the bottom part of the face. So we look at the upper face, the lower face, and see what we can do. And this is basically a chart looking at what is available, skincare, everybody, for sun damage, for acne scars, for fine wrinkles, for deeper wrinkles, and of course, when there's too much of excess and sagging skin, you're going to have lifting procedures. So that in that category, there's nothing we can offer. So I think a comprehensive skincare program is very important. So you've looked at the importance of physical appearance in today's society, psychological and psychosocial impact, and all the studies that have been done relating to this. Facial rejuvenation can be safely and effectively achieved, and I think patient evaluation and proper selection of rejuvenation techniques requires thorough knowledge of available therapeutic options. And I think that's what's important, that you are familiar with everything that's available and that you can offer every patient specifically more what they need so that they can have some really nice outcomes. So we can all look like this and have beautiful porcelain-looking skin. Thank you very much. Thank you. Okay. We're going to take questions, 5 minutes of questions.
How long, I know how long it takes, but after you have, are they numb with a topical agreement
For what procedures?
for the filler?
She's asking us, do you need to be numb for filler agents? Normally you don't. Collagen, people tolerate it pretty well. They're little injections depending on where you're going to do it. And it's you know, some patients that don't have a lot